Do you know what to do in a medical emergency? This is a question we all need to ask ourselves because the answer could mean the difference between life and death. Today, we're diving into the world of first aid, a crucial skill that everyone should have in their toolkit. First aid isn't just for healthcare professionals. It's for teachers, parents, office workers, and you. It's for anyone who might find themselves in a situation where immediate medical help is needed. Think about it. What if you're the first person on the scene of a car crash, or your loved one starts choking during dinner? Your knowledge of first aid could drastically change the outcome of these scenarios, potentially saving a life. But don't worry if you're feeling overwhelmed. First aid isn't as complicated as it seems. It's about understanding the basics and knowing what to do when the unexpected happens. Today, we are going to break down first aid procedures into simple, easy-to-follow steps. First, we need to understand the ABCs of first aid: airway, breathing, and circulation. When we talk about the ABCs of first aid, we're referring to the three critical components that we need to check when we find ourselves in an emergency situation. These are the fundamental steps that can spell the difference between life and death. Let's start with A for airway. The airway is the path that air follows to reach the lungs. If it's blocked, oxygen can't reach the lungs, and therefore the rest of the body. Imagine you're enjoying a summer barbecue, and suddenly, someone starts choking on a piece of steak. Their airway is blocked, and you need to act quickly to clear it. That's where the A in ABC comes in. Next is B for breathing. Once the airway is clear, we need to ensure that the person is breathing. Breathing is how oxygen, which is critical for our cells, gets into our bodies. If someone isn't breathing, they might need rescue breaths to help get that vital oxygen into their lungs. Picture being at a pool party when someone is pulled from the water, unconscious. You've cleared their airway, but they're not breathing. In this case, B for breathing becomes your immediate focus. Lastly, we have C for circulation. This refers to the movement of blood throughout the body. Blood circulation is essential because it transports the oxygen we breathe to our cells. Suppose you're hiking and a friend slips, injuring their leg. They're breathing, but the injury is causing a lot of blood loss, affecting their circulation. It's then crucial to stop the bleeding to maintain proper circulation. These ABCs of first aid are not just letters, but actionable steps that we can take to potentially save a life. They remind us to ensure the airway is clear, to check for breathing, and to maintain circulation in an emergency situation. Remember, the ABCs of first aid are the foundation of any life-saving response. Imagine this scenario. Someone near you starts choking. What should you do? In such a frightening situation, it's crucial to remain calm and act promptly. The first step is to determine whether the person can cough, speak, or breathe. If they can, encourage them to cough to try to clear the obstruction themselves. However, if they can't, or their face turns blue or ashy, it's time for you to intervene. This is where the Heimlich maneuver comes into play. Standing behind the person, wrap your arms around their waist and lean them forward slightly. Make a fist with one hand and place it just above the person's navel. Grasp your fist with the other hand and deliver 5 quick, upward thrusts into their abdomen. If the person is unconscious or you can't get your arms around them, you can perform chest thrusts instead. Lay them on their back, kneel beside them, and place the heel of one hand in the middle of their chest. Place your other hand on top, then push straight down about 2 inches and let the chest rise completely before pushing down again. These actions can help dislodge the item blocking the airway, allowing the person to breathe again. It's a simple but crucial technique that can truly save a life. Remember, every second counts in these situations. The quicker you act, the better the outcome can be. Choking can be life-threatening, but with these steps, you can provide immediate help. Bleeding is another common emergency that requires immediate first aid. When it comes to bleeding, the key is to remain calm and respond quickly. Let's walk through the necessary steps to manage this kind of situation. First and foremost, you need to ensure your safety. Always wear gloves if they're available to protect yourself and the injured person from infection. Next, apply direct pressure to the wound. Grab a clean cloth or bandage and press it firmly against the injury. If you're dealing with a minor cut or scrape, this action alone will often be enough to stop the bleeding. If the bleeding is more severe, continue applying pressure and elevate the wound if possible above the level of the person's heart. This helps to slow the bleeding by reducing blood flow to the area. But what if the bleeding doesn't stop even after applying pressure and elevation? This is where a tourniquet can come in handy. A tourniquet is a device that you can wrap around a limb, above the site of heavy bleeding. Once in place, you tighten it until the flow of blood stops. Remember, tourniquets should only be used for severe bleeding that cannot be controlled by pressure alone, and they should never be placed over a joint. While you're taking these steps, it's also essential to keep the injured person calm. Reassure them that help is on the way and that they're not alone. Speaking of help, when should you call for professional medical assistance? If the wound is deep, large, or caused by a serious accident, call for help immediately. If the injured person feels weak, faint, or confused, or if the bleeding does not stop after 20 minutes of direct pressure, these are also signs that you need to seek professional help right away. Remember, your quick action can make a significant difference. Bleeding can be scary, but with the right first aid, you can prevent further blood loss until professional help arrives. With the right first aid, you can prevent further blood loss until professional help arrives. Burns can occur in many different situations, and knowing how to respond is crucial. First things first, it's essential to assess the severity of the burn. We classify burns into 3 categories: first degree, second degree, and third degree burns. First degree burns affect the top layer of the skin, causing redness and mild swelling. To treat these, cool the area gently under running cold water for about 10 minutes, then cover it with a sterile non-stick dressing. Over-the-counter pain relievers can be used to manage discomfort. Second-degree burns penetrate deeper, causing blisters and severe pain. The same initial treatment applies. Cool the burn under running water and cover it. However, it's crucial not to pop any blisters, as this can lead to infection. If the burn is larger than 3 inches in diameter or on the face, hands, feet, or a major joint, seek immediate medical attention. Third-degree burns are the most severe, damaging all skin layers and possibly underlying tissues. They may appear white, charred, or translucent, and the area may feel numb. Do not attempt to self-treat these burns. Call emergency services immediately. While waiting for help, try to keep the person calm and elevate the burn if possible. Do not remove any clothing stuck to the burn, and never apply ice or cold water, as this can intensify damage. Remember, correct first aid can minimize damage and speed up recovery from burns. We've covered a lot of ground today. Let's recap. We kicked off our discussion by introducing you to the concept of first aid, illustrating its importance in our everyday lives. We talked about how this immediate, temporary treatment given to an ill or injured person before professional medical help can be provided can be a crucial factor in the outcome of an unforeseen incident. Next, we delved into the ABCs of first aid, where A stands for airway, B for breathing, and C for circulation. We explained the importance of ensuring that the airway is clear, breathing is normal, and there is adequate blood circulation. These are the fundamentals that can be the difference between life and death. Then, we explored the topic of choking, a common occurrence that can turn fatal if not promptly addressed. We walked you through the Heimlich maneuver, a simple technique that can dislodge the foreign object causing the choking, potentially saving a life. Our discussion moved on to bleeding, another frequent accident that can have severe consequences if not managed properly. We discussed how to control bleeding by applying pressure, raising the wound, and using a bandage. We emphasized that quick action can prevent further complications and even death. Lastly, we addressed burns, explaining the different degrees of burns and their appropriate first aid responses. We stressed the importance of cooling the burn, covering it, and seeking medical attention, especially for more severe burns. In essence, we have imparted some basic first aid knowledge that can be extremely beneficial in emergencies. But remember, this is just the tip of the iceberg. There's a wealth of information out there that can equip you to handle a wide range of medical emergencies. We encourage you to learn more, to attend first aid classes, and to always be prepared. Always remember, your knowledge of first aid can make a difference. It can save a life.